During the process of in vitro fertilization, we usually have to follow a woman's follicle growth as she's undergoing medications to allow a nice group of follicles to grow. The goal of this close monitoring is to allow safe completion of the treatment, but also allow her to grow multiple follicles in hopes of achieving multiple eggs to give her enough chances to achieve a healthy pregnancy, and sometimes it's a nice blessing to have a backup chance as well. The ability nowadays to freeze eggs, freeze embryos with our newer technologies allows us to build in a backup plan when we're undergoing treatment, particularly for couples who are thinking about larger families in hopes of not having to do this type of therapy over and over again. Once an egg or an embryo is frozen or cryopreserved, we know that it stops the clock, so to speak, and allows that woman to achieve a healthy pregnancy later on. Once a woman has completed the medication portion of the treatment cycle for IVF, or in vitro fertilization, next comes the egg retrieval procedure. During that procedure time, usually the women undergo some light sedation during the procedure. The procedure itself is done ultrasound guided with a small needle, and with one poke on each side, we're able to retrieve the follicles or the eggs that she has created throughout that IVF process. Once the eggs are out, the eggs are washed and put with the sperm. Overnight, the insemination or the ICSI process allows those eggs to fertilize. And the next day, we're usually calling them with an update phone call about how many of the eggs accepted the sperm and have fertilized. And at that point, they should be 2 cells in size. We then allow those embryos to grow up to the stage where we call them a blast. And if they've been growing and dividing appropriately, a blast should give them a strong group of cells that we call their embryo that allows them a future chance for pregnancy. The nice advancement nowadays is we're able to test those embryos to be able to look at chromosome abnormalities or genetic issues depending on what the couple is interested in and what is appropriate for the age and the underlying factor for the couple. That allows us to know some of this information before the pregnancy is achieved to allow us to set them up for a nice, healthy, successful pregnancy.